Are you someone who's suffering with chronic headaches or chronic migraine headaches and you're tired of taking medication and you want a natural solution? Listen carefully. Many people who suffer with these types of problems have been told by their doctor this due to stress or it's due to certain foods that are triggering, and it's true. Stress never makes anything better. But I always tell patients when they've been told this that I can find a couple hundred people that have lots of stress in their life and they don't suffer with headaches and they don't have migraine. So while doing lifestyle modification can help improve the situation, there's always got to be an underlying reason why that's happening in the first place. I was someone who suffered with chronic headache, not a migraine, but a chronic headache, like someone kicked me in the back of the head, for about 2.5 years following a wrestling injury where I was dropped on my head. And in our office, we find people who have chronic headaches, generally speaking, have had some sort of whiplash type trauma. And the reason whiplash type trauma can be the underlying root cause of these problems is the joints in the neck, in the upper neck. You have the head that weighs 10 to 12 pounds and it sits on the top vertebra in the neck called the atlas. And the head-neck junction is a very unstable junction when it comes to injury. So when someone's had an injury, the joint can dislodge, it can tear the soft tissue. And when the joint dislodges and the soft tissue gets torn, the muscles typically lock down, you lose joint motion, and then all of a sudden you have chronically tight muscles, and these people, generally speaking, feel pressure at the base of their skull. They can feel pressure in the temples, behind the eyeballs, and it's the result of that joint not moving how it should and causing aberrant signals in the central nervous system, which causes the muscles to lock down. And the solution is to get that joint that's locked back in motion, and most importantly, keep it in motion so the soft tissue can heal up around the joint, and the underlying reason why they're suffering from those problems can be removed and heal up so it doesn't exist there anymore. So if you're someone who's suffering with chronic headaches, you're sick and tired of taking Imitrex every day or popping Advil or Excedrin because you know it's not good for your liver, and you maybe even have stomach problems because you've taken so much ibuprofen. I always tell patients you don't have health issues because you have a drug deficiency, you have health problems because you have a function deficiency. So get to an upper cervical chiropractor, get them to assess the upper neck to determine if you have one of these structural problems. And then if you do, we take 3D imaging to assess exactly how you're out of position, what the angle of the joint is. The correction is painless. This is finesse, not force. It's gentle, it's precise, and it's effective. There's no twisting, popping, or pulling. The long-term objective is to get it to heal up, so you don't need to see us very often, and you just get checked kind of like a dental checkup. So I hope this video has reached some people and will change their life for the better.